They knew we were do-gooder, kind-hearted, salt-of-the-earth kind of people. But they didn't know that we had a BSW, an MSW, or a doctorate degree in social work. They didn't know about social work licensure. And they honestly thought that they would never need a social worker. So one of the issues that we're always coming up against, and when we talk about nursing, everybody has a nurse. You were born, so you probably had a nurse. You had some kind of illness, you had a nurse. You had a teacher. Everybody knows and teacher is another profession that was invested in at some point by the federal government. Not everyone had a social worker growing up, so I'm sure there are many of us who cannot say, Susie was this excellent social worker who helped me through X. But I don't think that's going to be the case anymore. Whether you or a loved one have cancer, have dementia, have child welfare issues, whatever the case may be, I think that every one of us will be touched by a social worker, whether it's through our own issue or through a familial or social issue, that you'll know somebody who has come in contact with a social worker. So we launched the public education campaign. We have a variety of ads. Our website, Help Starts Here, is focused on consumers. So we're really trying to help people understand that while child welfare is incredibly important, it's not the only thing that social workers do. And it was mentioned before too, and particularly since we're in the Management Institute, that a lot of people have said, well, I used to be a social worker, I'm a manager now, or I'm an administrator. At the annual leadership meeting, we had Jared Bernstein come and speak, and Jared has a PhD in social welfare, he has an MSW, and he just left, he was chief economist to Vice President Biden. So he came and spoke to us, and he was standing up there, and he said, I'm really happy to be here. I'm a former social worker, and I swear every person in that room sort of jumped up. And they were like, you're never a former social worker. And this poor man is like, I'm sorry. So I don't know if he's going to come back and speak to us, but we certainly made an impression on him. So those are the three pieces that made up the Social Work Reinvestment Initiative. That we kept hearing that these are issues that are going to be significant in the profession, that schools of social work are having a hard time recruiting social workers. They may be going to psychology or another helping profession, or they're dropping out after having to pay so much educational debt. So where do we go from here? And this was a question we asked in 2007-ish. What would we do to address the issues, the workforce issues in social work? And we came up with a couple of different strategies. The Social Work Reinvestment Initiative as a whole has the goal to secure federal and state investments in professional social work to enhance societal well-being. So that's a pretty big goal to accomplish, but we have three different ways in which we're trying to do this. The first, and I apologize, the colors are a little off, chapters. We have 56 chapters in every state and in ROM, New York City, DC, International, Puerto Rico. And each chapter has a reinvestment plan, which I'll talk about in just a second, but each chapter focuses on state level issues, because what might be a concern in West Virginia may never cross our mind in DC and vice versa. So we wanted to make sure that the states each had a reinvestment plan that helped them to accomplish the issues that were going on in their state. We also focus on different pieces of federal legislation, which I'll talk about in just a minute, and then finally the Social Work Reinvestment Act. So the state level issues. Loan forgiveness is a huge issue, like I mentioned. Licensure, which the second number one question I get at the national office, I have a license in Tennessee, can I go work in Nevada? There's no licensure reciprocity. So, unlike nurses who may have an emergency, they have their compact and they may be able to go over state lines for emergencies, social workers are having a really difficult time. So I talk to a lot of social workers who have retired in one state and they want to go work in another state. They're going with their spouse or their partner or whomever, and they have to leave their career behind because they can't get that social work license in another state. So that's another thing that we're looking at. Enhanced pay, use of research to improve practice and development of practice-based research agendas, public education, title protection, all these things that and this is a good point about emerging leaders, these things that I never had any concept of when I was in social work school. If someone had explained to me that there are over 40 different licenses in the country, I would have no clue, where to even start with that, about title protection, about, all of these professional issues that I live and breathe now on a daily basis. When I was in school, I had no concept of how to address those, of how, how to go about doing them. And I think they're really important because I think these things are the things that are driving people out. There was a study done on social work in which it was found that social workers have a taste for the profession. So, most of the time I don't think it's the clients, I don't think that it's the issues that you're dealing with on a daily basis, because this is the core of who you are. You're a social worker. A lot of people say they were born to be social workers. You live and breathe this stuff. It's your daily life. But if you have to deal with all of this other stuff that is really complicated, really frustrating, which is why Sam does such a great job in West Virginia of really working on the advocacy and helping to promote social work in the state. So recently, some of the social work chapter reinvestment successes. Oregon passed state legislation encouraging Congress and President Obama to support and pass the Dorothy Height and Whitney Young Social Work Reinvestment Act. New York State was just awarded $150,000 to focus on the mental health of veterans. Ohio, they have an emerging leader outreach program, and they recently came to DC and met with President Obama to talk about how they can engage youth in civic engagement. And then Nevada recently successfully fought the closure of a school of social work. So we're also seeing this across the country a lot. Schools of social work saying, you all aren't bringing any research funding, or your student numbers are down, things like that. So you can focus. In Nevada, it was Reno and Vegas, which are pretty far away. So it's similar to if you're a student in Morgantown, are you going to travel across the state to get your MSW, or are you going to say, well, there's a human service program, or I can go to psychology school or education school, or maybe I just won't continue my education. These are the things that we're fighting against, because we think that there needs to be schools of social work available to students. So the federal legislation that we're working on, the Social Work Safety Act. Has anybody heard of Terry Zinner? And I know that there was a murder in West Virginia as well, but Terry Zinner was really the first social worker to sort of kick off, this really intense concern for social workers. She was a social worker in Kansas. She was killed, brutally murdered. I mean, it was terrible. I won't repeat what happened, but her husband came home, and she had been murdered by her 17-year-old client, whose mother had been out getting groceries. She wasn't there when she arrived. So, and we're seeing this. There was Bonnie Frederick in Kentucky. I mean, there was someone in New York. Constantly, every few months, there's a social worker who dies, and then everybody gets really excited. They whip into a frenzy, and they want to make sure that social workers are safe, and they want to make sure we can go out and take care of the children. And then it dies down, and nobody does anything about it. So the Social Work Safety Bill is an attempt to help to remediate some of that and help social workers get training. It always amazes me that police officers will not go into a house without 2 police officers, 2 guns, 2 billy clubs, yet a social worker, who's often, particularly in child welfare, a younger woman, will go in with no backup, with her cell phone, and no training, and be expected to help to fix the situation. So I think that the Social Work Safety Act is incredibly important. The National Center for Social Work Research Act is a bill that would establish a Office of Social Work Research within the National Institutes of Health. Again, there's a nursing research office. There is a variety of different offices. You look it up, it probably exists. But social work is so important because the research that we do, you name a social problem, we do research that addresses it. It's critical to